One of the most common procedures I do in the shoulder is called rotator cuff repair. The rotator cuff, I want you to think of 3 pieces of rope. And those 3 pieces of rope are responsible for moving your shoulder. You might think it's the big muscles on the sides of your shoulder, but actually those are just for strength and power. Those 3 pieces of rope are responsible for getting a gallon of milk out of the refrigerator, for drinking a cup of coffee, for even shampooing or combing your hair. Sometimes those 3 pieces of rope can be injured. Most commonly it's one of the 3. As you would imagine, a piece of rope can tear in a couple ways. One is it can fray, or one it can tear in half. Rotator cuff repair is performed when the rope has torn off of the ball of your shoulder. This procedure is done with the assistance of an arthroscope or camera. Typically it begins with 3 small incisions where the camera is used to find the tear and remove that common bone spur in the shoulder. Removal of that bone spur will allow you to move your shoulder after the surgery, limiting the risk of it re-tearing. The lateral, or the incision on the side of your shoulder, which starts out about 1 centimeter, is typically extended to almost 1 inch or sometimes a little more. By splitting the muscles on the side of your shoulder, we're able to find that tear. To repair it, we use small sugar anchors. And these anchors, I say they're sugar because they dissolve anywhere from 18 months to 2 years. The sutures are very strong. We pull that rope back to where it's supposed to be attached in the bone of your shoulder. The operation takes anywhere from 30 to 45 minutes. After the surgery, you're in a sling for anywhere from 4 to 6 weeks. And that's just simply the time it takes for that rope or the rotator cuff to heal back to the bone. You'll begin physical therapy as early as 2 days after surgery. Our goal initially in the first 6 weeks is to make sure we don't get a stiff shoulder. 6 weeks after surgery, and even sometimes beginning at 4 weeks, you'll start helping the therapist or moving the shoulder on your own. You start to return to activities that you enjoy doing. By 3 months, you've got a lot of the motion back. Although it may not be all the motion, you're certainly starting to do things more normally. At 3 months, we'll start resistance training or weightlifting or strengthening the shoulder. By 6 months, we'll allow you to return to all your activities, whether that be hitting a tennis ball, throwing a softball, or throwing a football. Over that next year, you'll get better every month. Our ultimate goal, get you back in your game.